Good morning. I'm Dr. Clay Dunagan, and I'm here with my colleague, Dr. Alex Garza, to deliver a brief but important message for this holiday season. We now know that Omicron is in Missouri and very likely is already in the St. Louis region. If it's not here yet, it will be soon, and that has really important implications for the region. Omicron is turning out to be much more transmissible, much more contagious than preceding variants. And we know that while it could possibly cause somewhat less severe disease, that for any individual, COVID with Omicron can still be a very serious illness, can land them in the hospital and cause death. And Alex, that has big implications for the health system as well.
You're spot on there, Clay. Really, as we talk about this, we worry that we're headed towards this perfect storm, where we have a highly transmissible virus in Omicron. We have a high number of people that are susceptible to that virus in our communities. As you know, we have reduced public health capabilities, and our hospitals are already full with more and more COVID patients being admitted every day. And on top of this, our workforce is really exhausted and they're demoralized, and it's tough to see where we can pull in any sort of reserves to help out with the influx of patients. Now, I used to teach a course in emergency management, and I taught my students that disasters occur when hazards times vulnerability outstrip capability. And if you think about that in our current experience, we have a hazard in the form of the virus, and we have a very vulnerable population, and we really have a limited capability to care for our patients right now because of those staffing issues and because of the level of patients that we're seeing. So really the only levers that we can pull to become less vulnerable are through vaccinations and public health measures. We're asking everyone, business owners, employers, and individuals to do whatever they can to decrease transmission of the virus. And one of those best ways is to wear a mask in public. So you know as well as I do that the research has shown time and again that these work to help blunt the rise. But also, as you mentioned earlier, we're seeing a huge surge in cases. And unfortunately, some of those people are going to get sick enough to come into our hospitals. And if we continue on that path, it's going to be really hard to take care of other patients, such as heart attacks and car crashes and things like that. So the things that we need to do to prevent that from happening is, first, if you're eligible, get that booster dose now. And I think that bears repeating. If you're eligible, get the booster dose now. And that's really true for healthcare workers and other people that have a high risk of exposure to the variant. Just do it now. Don't wait. Now, many of you know that the Omicron is the dominant virus in the US and is quickly going to become dominant in St. Louis. And so if you haven't been vaccinated yet, it's really important to start that series because it takes time to build up immunity. It's not like a drug that acts instantly. It takes time for the body to build up those antibodies. And so it's important to start it now so that you can build up that protection as time goes on. You know, we're constantly hearing from patients that come in with COVID that get admitted to the hospital that they're requesting the vaccine. And so I think there's this misunderstanding that vaccines work instantly. They don't. They take time. And that's why it's important to start now to get vaccinated. But that's also a reason why masks are important, because up until you achieve that immunity, you have to do everything you can to protect yourself. And Clay, I know you've been really clear about the science and the need for masks. So maybe you could talk a little bit about that.
Yeah, Alex, I think in every way you look at it, whether they're small experiments or looking over populations, we see that masks work. They do prevent spread of infection, and they're highly effective if used appropriately. We've gotten a little caught up in the public debate about whether masks should be mandated, and we've let the political issue of mandatory masking overshadow the clear science that says masking is help in preventing spread of disease. So we want to urge everyone to pay attention to that science, especially now with a more contagious variant in the area. Now, you know, this is a really important time of the year where people gather to reconnect with loved ones. We're not asking people to cancel their holidays, but if people are going together, they can do so safely. If you're attending a gathering with people who are not at high risk and who are all vaccinated, you should be able to gather safely. But we urge you, anytime you're in a gathering, uh, consider the most vulnerable person that's going to be attending that. If it's someone whose immune system doesn't work well or who is not fully vaccinated, they're at high risk of acquiring COVID and not only getting sick themselves, but spreading it to others. In those circumstances, it's very important that people wear masks and keep socially distanced, be outside wherever possible, and limit exposure time. So if people can do these things, we'll really decrease transmission in the region and take stress off the health system and off of families and vulnerable individuals. So with that, we'll wish you all a happy holiday and safe holiday season. Please get vaccinated. Please wear a mask when appropriate. And we'll see you in the near future.